My name is Christie Barnes. I'm an ENT specialist at Nebraska Medicine. Sialendoscopy is a pretty new procedure, and we here at Nebraska Medicine are the first to introduce it to the state of Nebraska. Sialendoscopy is an exciting, minimally invasive procedure which involves small little cameras that we insert into the duct of the salivary gland, or your saliva glands. There are 4 major saliva glands, and occasionally the ducts can become blocked by obstructions, which usually means there's a stone or a narrowing of the duct itself. The Sialendoscopy allows us to insert a small camera into the duct and remove stones or widen or open up the duct to allow function of that salivary gland. Folks with salivary gland obstruction will typically suffer from recurrent swelling or pain, particularly around meal times, because the salivary glands or spit glands actually contract in order to lubricate the mouth for eating. And if there's a blockage in the ductal system that drains saliva into the mouth, then they'll get this intense pain and pressure around the time when they're either thinking about food or when they're about to eat. Occasionally, if that saliva gets backed up and it can't go through the duct, that saliva can become infected, and patients will get big swollen, either parotid or submandibular glands that are infected. If not treated properly, an abscess can form and need to be drained. Generally, salivary gland strictures or stones are treated at home for starters, generally involving, especially if the gland becomes infected, then it's treated with antibiotics and massage and warm compress and things like that at home. If this becomes a chronic problem and the stone persists or the stricture or narrowing persists, then generally the next step is to remove the gland. Where Sialendoscopy comes in is sort of an intermediate step that allows us to restore function of that duct without having to remove the gland and put the patient through the risks of the surgery itself. Sialendoscopy allows us to treat the ductal obstruction, that area of blockage, and allow the normal saliva flow to continue. In general, we've gotten a lot of great feedback from Sialendoscopy. We're able to treat a variety of problems with the salivary duct, and it really saves people from the potential risks and complications of a surgery. And so we've got a lot of great feedback in restoring the function of the gland and getting people back to their daily routine.